Hello, my name is Natalie. I'm 20 years old and I have thoracic outlet syndrome. And this is making this just so if you do have TOS, especially if you're a young woman like me, you don't feel so isolated because you're not alone. There is people out there. Even though it's only 1% of the population, there are people out there that share your struggle. So please hang on. You're not alone. Ooh, anyway, I just had my surgery on April 11th. It is now April 7 days later, and I feel amazing. I just have some numbness. That's probably not going to go away for several more weeks, but numbness. Can't really feel anything here. Pardon my hairy armpit, but there it is. That's the incision, and then that was where they put the drain. Very tiny, but I had the surgery to remove my first rib and part of my cervical rib because I am one of the special ones that have cervical ribs, which is more common in females. And if you have cervical ribs that cause thoracic outlet syndrome, that case is 0.02 to 0.05% of the population. So less than half a percent of the population has this issue. So it's extremely isolating. And I live in Los Angeles. I'm a student. I study musical theater at the studio school. And I don't have any family out here. They're all in Virginia. They did fly out. My parents flew out for the surgery, but I did all of this on my own. I had to face this all on my own, and it's really been a struggle. But that doesn't matter anymore because we're recovering and things are going to get so much better. But if you're curious about how it went, I had it at UCLA Medical Center. I had my consultation on March 3rd. Wasn't playing around. I said, we're scheduling this surgery now. I didn't want to try the nerve block, the injection, because it's not long term. It lasts a couple months, but I know that I want to get rid of this long term. So I said, Doc, take the rib out of me. I want it out of me. I want it out of me, I tell ya. And so he said, okay. And I scheduled my surgery for 4/11. And that is when I had it. And I showed up in the morning, checked in. They got me into the room. They got me back. So they put my IV in around 9:45, I want to say. And that was that. Then I got changed, got in my got my mind on my neck. But I put the gown on. I had to do these, I hadn't seen these before, I didn't know about it, but you have to swab the inside of your nose with iodine, and then it makes you all orange. It's kind of weird. But I talked to my anesthesiologist, I talked to the nurse, the main nurse, I talked to the surgeon, vascular surgeon, Dr. Hugh Gelabert, and then I was given something to make me happy and sleepy and fuzzy, and I was that way. They wheeled me to the surgery room. They asked me what my favorite musical was. I said The Lion King. And then they put an oxygen mask on me, and that's the last thing I remember. So they gave me my anesthesia, and I just fell asleep, and I slept like a baby, didn't feel a thing. And they cut me open, and they found something interesting. So it's already interesting enough that I have the cervical ribs, which is an anomaly. I'm an anomaly. They found that the scalene muscles, which are supposed to be like this, they're supposed to be forming an isosceles triangle with your first rib. This is your first rib. These are your scalenes. And this is the hole, the thoracic outlet, that the subclavian artery and the brachial plexus goes through, and then there's another one for the vein. All this to say, instead of this being this way, for me, these muscles were attached to each other. So this is called intercostalization. Pretty rare. And Dr. Gelabert was like, yeah, I see why you were in pain, because it was effectively forming a death chokehold on my subclavian artery. So, no good. I definitely did the surgery. So they got the first rib out of me, and it's actually funny because Dr. Gelabert has all of his patients' ribs archived on his phone. So he's just got a phone full of people's ribs, and they're bloody. They're all bloody ribs. And he showed it to me. It's pretty grotesque, but it just felt good because it's not inside of my body anymore. But the surgery lasts about, for me it was about 3.5 hours, because they were trying to find a room for me. There was a little bit of a backup for the rooms. They did find a room for me, but when I woke up, I was still in the operating room, and they were playing The Lion King again, and they go, "Hey, do you hear it?" It's like, yeah, The Lion King. Dr. Gelabert says when they listened to Circle of Life, they all just got pumped for the surgery, so I'm glad that I could give them that experience. But they wheeled me to the recovery unit. They call it TRU, Transitional Recovery Unit. TRU. I never actually made it to my own room or anything. I just was in the recovery unit. They gave me Dilaudid, and they gave me ibuprofen and Tylenol, and I don't think they give me, yeah, no, they gave me oxycodone in the hospital. So I was given these medications, and for the Dilaudid, they gave me a little button that I press every 10 minutes, and it wouldn't work if I had chosen an interval that was less than 10 minutes. But every 10 minutes I could press it, and it would give me opioids, and they want to get me off of that as soon as possible. I didn't want to be on it, and the doctors don't want to keep people on opioids because of everything that opioids come with. the many, anyway. So they gave me that. It made me really nauseous. I didn't want to use the bedpan because I'm too prideful, and so I had the nurse take me to the bathroom, and when I got up and walked around, I was just so dizzy, so nauseous. One time in the middle of the night, I did end up vomiting, but it was just once, and they gave me medicine to help the nausea, and they gave me this patch right here to help, and I went home the next day. I was in the hospital for a little over 24 hours, so I got there at so almost 2 full days, but I didn't stay 2 nights, so I got there at 8 a.m. in the morning on Thursday, and I left at 7 on Friday. And my parents just took care of me. I took probably 5 or 6 of the oxys, and the rest was just Tylenol and ibuprofen. And they were great. Anyway, just side note, the hospital, great. I would totally recommend it for everyone. I'm in LA, so it was easy for me to reach out to them and find them. But just wonderful. It was just wonderful. Wonderful experience. I didn't feel any pain. Still don't feel any pain. It's just numb and a little bit swollen still. And I don't really feel anything in this area. But they gave me, if you go to UCLA, I think I might be just the 3rd or 4th or 5th person that they gave this machine to. But if you do have the surgery, there's still water in this, but they give you this refrigerant cooler, and you plug it in to the wall, and then, oh god, okay, and then this goes around your arm, and there's straps to keep it in place, but it just cools your arm to help with the swelling. It's really helpful. I could have used that before I got the surgery, so I probably will continue to use it. But overall, wonderful, wonderful experience with my surgery. I still, I just feel great. I probably am recovering faster and easier than some people might, but I'm very blessed for that. And I've been driving. I'm not on the medication anymore. I stopped taking the oxys after 3 days or 4 days. So I'm just on Tylenol and ibuprofen now, just helping with the swelling a little bit, but it's really that's it, and I'm fine. I still feel it a little bit. I'm trying to tell myself to relax because there's nerve damage from having it like that for so long. Why am I out of breath? Okay, breathe. So, it's been a journey, for sure. And I just wanted to reach out to anyone. If you want to ask questions about my experience, or if you want to reach out and share stories or anything, I'm here for you. Let me know in the comments down below. That's my story. Thanks.